Botox injections have been a popular cosmetic procedure for many years. A Botox cosmetic injection is often used to reduce fine lines and wrinkles on the face, lips, and forehead. It works by temporarily paralyzing muscle using botulinumtoxin type A, especially Onabotulinumtoxin A. Procedure frequently used to treat migraines and other headaches. Botox is a neurotoxin, a protein produced by the same bacterium as Clostridium botulinum. It blocks the release of an amino acid neurotransmitter called acetylcholine by receptor binding sites at the neuromuscular juncture, causing botulism. Botulinum, also known as Botox, may cause rare, possibly fatal, problems with the nervous system, including seizures, and it is extremely important that any patient who plans to receive a Botox cosmetic injection understand and be aware of these risks. Botulinum toxin produces a neurotoxin, in essence, a dangerous protein that can block nerve transmissions, but the toxin itself is non-toxic. In actuality, Botox, a clear, colorless fluid, consists of a colorless saltwater solution that is injected directly into muscles, and then the fluid evaporates and leaves the body nearly immediately. In its pure form, Botox is a gelatinous substance that does not cause side effects, although injecting Botox can cause pain and muscle weakness in the patients that receive it. The Botox injected into muscle cells does not damage the muscle directly, but works by stimulating a nerve or motor nerve to stop functioning. Botox is most commonly used for muscle weakness or spasticity, where the muscle requires temporary immobilization in order to repair itself. The typical site of Botox injections is in the face, where the muscles involved are thought to be less mobile than elsewhere in the body. Some celebrities have used Botox to improve their facial mobility, and it has even been used in some cases to help tone the neck. Botox was initially developed to treat severe muscle diseases like muscular dystrophy, and is often used today in cosmetic clinics for wrinkle reduction, where it is an alternative to surgery. Botox is injected directly into the muscles or into the site of muscle contractions. Once in the treated area, the toxin causes a lasting effect. When considering whether to have Botox or injections, it is important to understand all the possible side effects and complications from the treatment. Most people do not require this treatment, but some do, especially if they have a medical condition that could prevent them from receiving oral medication or want a more customized effect. There are 3 different classes of effects from botulism. Botulism A, rare hereditary type of illness, botulism withdrawal syndrome, which sometimes occur after Botox injections, and toxin-induced botulism, which are caused by an incorrect dose of the toxin. Of these, the rare form is the only one in which serious complications may occur, as injecting too high of a concentration of toxin can cause respiratory failure, weakness, and difficulty breathing. In cases such as toxin-induced botulism, it is highly recommended that low doses are given, with regular monitoring to ensure proper safety. For this reason, Botox has become more widely used over the years, rather than being reserved for severe facial muscle ailments. Today, injections are offered at any stage of the aging process. For reducing frown lines, eliminating crow's feet around the eyes, or increasing leg and arm muscle coordination. Botox can also be used to reduce wrinkles around the mouth, lips, and chin. Botox is usually injected into specific areas, which vary from person to person, as small areas of muscles tend to react differently than larger ones. For this reason, it is important to consult a qualified physician when considering this treatment. Botox can also be used in conjunction with other medical treatments, although many physicians prefer to treat all patients with Botox only. One of the common reasons why Botox is used in conjunction with other treatments is because Botox is quite safe when used under the guidance of a qualified medical professional. In fact, Botox has been approved by the FDA for use by patients with a large range of medical conditions, including muscular dystrophy and multiple sclerosis. The majority of patients with these conditions recover completely from their medical conditions, as Botox has a very high success rate when treating them. It is also FDA approved when used to treat the primary symptoms of these conditions, without causing any additional side effects to the patient. Because Botox causes very few side effects, it is very often used instead of surgery, as the former has a higher success rate and fewer risks. Botox injections have proven to be very effective for eliminating the various signs of aging. Though they are most effective during the later stages of life, the average person can see results from Botox treatments within 1 to 4 months of receiving the injection. During this period, the patient should rest and make sure to have minimal activities that could cause too much muscle strain. Though Botox cannot reverse the effects of time, it can improve the looks of tired or sagging skin and eliminate those fine lines around the eyes and mouth.